The NHI will be like a giant state medical aid. It'll buy health services from both government and private health facilities, but at a set price. The NHI fund will be created to pay for services, but the government doesn't have nearly enough money. Currently, the public health sector services about 85% of our population. Only 15% of people in South Africa can afford medical aid that pays for private healthcare. But the amount of money spent on the 15% using private healthcare and the 85% using government hospitals and clinics is the same. The government says it needs the premiums people pay to their medical aid schemes. So, our NHI bill says medical aids in their current form will be illegal. Medical schemes won't be allowed to pay for the same services that the NHI provides. Only top-up services will be allowed. Some experts say this goes against the Constitution.
The prohibition on medical scheme coverage is very unlikely to succeed because it's a protected right in terms of the Bill of Rights. So if somebody wants to be protected by this form of cover, they can take them to court. It's very likely that there will be multiple parties who challenge that particular feature of the bill.
The medical aid industry says it has a right to exist, at the very least to help the NHI process payments.
This has been a structure for many decades, and schemes have got the necessary expertise, they've got the systems and processes that they have been used that have been refined over time.
We think that the bill would be much more feasible and much more easily implemented if Section 33 was amended to say that the role of medical schemes will be determined at a later time through a collaborative and a consultative process. That kind of amendment, which it's only a few words in the Act, but relative to today's position of medical schemes will not be entitled to have a role. That would lead to a collaborative process over the next 10 years.
As the bill stands right now, however, only the state will be allowed to administer NHI funds. The National Assembly passed the bill in June. The next step is for the National Council of Provinces to adopt it.